Today, me and Claire are going to discuss the parallels between COVID-19 and Ebola. So just to give you the content, we're just going to give you brief background, an extensive background information on both of them, and talk about the transmission and give you some data, statistics, and analysis on the subjects.
Okay, now I will talk about the COVID-19 background. COVID-19 is an ongoing global pandemic. This virus first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a public health emergency of international concern on January 30th. And a pandemic on March 11. As of August 3rd, more than 17.9 million cases of COVID-19 have been reported in more than 118 countries. There were more than 687,000 deaths, but more than 10.9 million people have recovered. COVID-19 has an incubation period of 2 to 14 days and is symptomatic. In the early days, people may lose their taste or smell. The main symptoms after the onset include fever, cough, tiredness. Different people will have some different symptoms, such as shortness of breath or difficulty breathing, muscle ache, chills, runny nose, headache, and chest pain. There will also be some common symptoms like rash, nausea, vomiting, and diarrhea. According to the data, children have similar symptoms to adults, but generally have mild illness. The elderly and those with chronic disease are at higher risk of cases like serious heart disease, cancer, HIV, and asthma. Studies have shown that this is caused by low immunity. So improving immunity is an effective way to prevent and treat.
All right, so Ebola. So what is Ebola? So Ebola, which was formerly known as Ebola hemorrhagic fever, is a deadly disease that was caused by one of the 4 Ebola virus strains, Zaire, Sudan, Bundibugyo, and Thai forest. These names, I believe they stemmed from the very first outbreaks. So Zaire which is now known as the Democratic Republic of Congo, was where they first identified Ebola by the Ebola River. So that's where basically I think these names stem from, which is basically all around Africa, mainly Central Africa, but there are cases like in West Africa as well. Within these 4 strains, the names where they generated from. So symptoms, you have dry symptoms, which include fever, abdominal pain, headache, weakness, and fatigue. And as your symptoms or as you get pretty much more sick, they progress to wet symptoms, which include but are not limited to gastrointestinal problems like diarrhea, vomiting, and unexplained hemorrhaging. Now, once you get to this stage, it is kind of hard to survive, but some people do. It's very aggressive. Like I said, it's very deadly disease, but it's a lot of people witness dry symptoms. But once you do, like I said, witness the wet symptoms, it's kind of really downhill from there. So symptoms can last from 2 to 21 days, but they usually average around 8 to 10 days, which is something we've seen with the coronavirus. So the origin of Ebola, it started, like I said, it was first identified in 1976 in the Democratic Republic of Congo in a village close to the Ebola River, which is where it got its name from. And the second time, which is around the same time, was in South Sudan, which is where the second strain, the name came from, Sudan. So after that, there were like several other outbreaks here and there, like in 1994, I think it was in Thai forest. So, which is in Cote d'Ivoire, which is a West African country. But the biggest and largest outbreak of Ebola, which became an epidemic, was from 2014 to 2016. And this outbreak was in West Africa. It began in a rural setting of southeastern Guinea, and it spread to urban areas, and then it crossed borders within weeks, and then it became a global epidemic within months. So the second largest, which just ended this year in February, was from 2018 to 2020, and back in the Democratic Republic of Congo, which is where it started to begin with. And that is the second largest outbreak, experiencing 3,400 cases within that country and 2,200 deaths.
Now we will talk about the transmittable. COVID-19 can be transmitted directly, indirectly, or closely contact with infected people via mouth and nose secretions. These are released from the mouth or nose when an infected person cough, sneeze, or speaks. People who are in close contact with an infected person can catch COVID-19 when those infectious droplets get into their mouth, nose, or eyes. At this time, these virus will also attach to the surrounding objects. People will get infected by touching the object and then touching their eyes, nose, and mouth before cleaning. Some infected people have no symptoms, but it doesn't mean that they are not infectious. Such a variety of transmission channels make the virus almost pervasive. COVID-19 spread rapidly, and there is no specific medicine, so it is difficult to prevent, but the death rate is not high. At present, the most effective prevention method is to wear a mask, don't gather, wash hands frequently, and disinfect.
All right, so the transmission of Ebola, scientists do believe the first infection was transmitted through contact with an animal known as a reservoir host, which is can be either a bat or a non-human primate, but most likely stem from a bat, which is very similar to COVID-19. So after this initial spillover event, which is when the reservoir host infected a human, the virus started to spread from person to person through direct contact with blood or bodily fluids from the person who is either sick or has died from the virus, and objects containing bodily fluids from an infected individual. So even if you are dead, you still go through, there's still like a period of time where you still remain infectious. So that's why there are stigma once you have survived this disease, which is kind of hard to survive. Once you do, there's still like stigma within like the community. They're just kind of like, you know, a little apprehensive or just scared to get in contact with you. But a key difference to note with Ebola and the coronavirus is when someone becomes like infected with Ebola, they go through, like Claire mentioned, an incubation period where they do not exhibit symptoms So with Ebola, during this period, you are not infectious, as opposed to coronavirus, you are infectious either way. Once you are infected, infected and you are not, whether you're exhibiting symptoms or not, with coronavirus, you are still infectious, as opposed to Ebola, you're not until you start exhibiting symptoms. So you can't spread Ebola to other people during that point in time.
The final part, we will do data, statistic, and analysis. This is the number of cases and deaths reported worldwide as August 2. Since March, the number of cases has shown an upward trend, while the number of deaths has been relatively stable. Next are two graphs showing the number of deaths and cases in some areas. We can find out that America has the largest number of deaths and cases. The number of cases is on the rise, and the death toll has not changed much. The number of cases in European peaked in March, and the number of deaths was very high. But from April, it was declining rapidly and has now stabilized. There are data for almost all countries here. It can be seen from the data that the death rate of COVID-19 is lower than that of Ebola, but because it can be transmitted by almost any ways and the initial symptoms are not obvious, so it has a higher number of infections.
All right, so I'm going to use Tableau that I found on the tracking of Ebola throughout the year of 2014. Okay. Wait. Okay. So we're going to start with the beginning of all this, which was in March 22nd of 2014 for the 2014 to 2016 outbreak. So it all started, as you can see, in Guinea, and from this collection of data, it was 49 cases that they had already started to witness. So less than a week later, still in March, there were cases in Liberia. So now you have in Liberia and in Guinea as well. So these two countries are just exhibiting these symptoms and these cases, and they start to rise eventually as time continues to progress, and you see that cases keep jumping, and the fatality ratio is really, really high. And that number honestly doesn't change throughout the whole time period, but the cases continue to just progress. And you see this tiny little country right here that's just surrounded by these two countries, which eventually 2 months later after the start of it all, which was March 22nd, leads to a case starting in Sierra Leone, which is this country right here. And like I said, cases continue to progress. Death rates are about 66%, which is really aggressive. So from that time, the way Sierra Leone received it was through a tribal healer, which was someone that was trying to heal people within the borders of these two countries. And his funeral, which probably was a traditional funeral, which involves a lot of close contact, may have led to 365 cases from that time period. So it wasn't till, as you can see, the numbers still continue to rise. 452 cases in June, and then we go to July. That number doubles, and it's getting really aggressive. So it wasn't until August. So from July, let's say July 2nd, you had about 779 cases. A month later, it jumps to 1,700. So around this time is when the World Health Organization declares the outbreak an international health concern. And schools started to close and people started to quarantine within these nations. So as you can see, Nigeria also gets into it. But they pretty much tried to contain it. So from then we move on to September. The number jumps to 4,000. And this time is when the US decided to get involved, and they send over 3,000 military personnel to set up about 17 different treatment centers. And the UN declares the outbreak a threat to international security and peace. So the numbers, like I said, they just continue to rise. That fatality rate is still at 53%, still pretty high. But with those troops, I think it definitely helped, because these countries are, well, at least some of them are developing nations. So you have to think about their healthcare system. It might not be all that well. So the cases continue to rise. So from October to December, cases are doubling. And by the end of the year, you have about 20,000 cases and approximately 8,000 deaths. So if you can see down here, there, it's just showing from the timeline of March until the end of the year of the cases within the three different prominent countries like Guinea, Liberia, and Sierra Leone. You see that Sierra Leone was the last to get into it, but it ended up being the one with the most cases by the end of the year. And Guinea was the one with the most deaths. Meanwhile, Liberia was one with the most deaths, but meanwhile, Guinea sort of had it under control to some sense. Then the year 2015 was when things started to look up, which is kind of how I hope it can kind of mimic with coronavirus. January, the World Health Organization reported fewer than 100 cases within a week. And in April, schools started to open up in Sierra Leone. And by October in 2015, it was the first week where they did not experience any new cases from all three countries. So by March of 2016, the outbreak officially ended in Sierra Leone. And then in June, it ended in Liberia and Guinea. And we experienced a total case report of over 28,000 and total deaths with 11,000. So that's about a 40% fatality rate overall, which is a lot. But the trade-off with this is that that incubation period, honestly, to me, I think that's what saved so many people. And other nations
Yo ya te está bañando, ¿qué está
about it.
pasando?
If you think about it, virus is, don't get me wrong, it is aggressive, but not as aggressive as Ebola. So if anyone can get affected during that incubation period, it probably would have caused some sort of plague, to be honest. So I think that's kind of like the difference with the two epidemics. So just want to thank you.